So I'm Lucy Brown. I'm the Director of Nursing Midwifery Leadership Development here at the Florence Nightingale Foundation. I'm a children's nurse by background and also work within IPC, got a postgrad in IPC, so really championing the cause that all of you have signed up for as well, and we'll talk more about that a bit later. I'm going to introduce my colleagues this morning, and then I'll go through the agenda and learning outcomes for the programme and a few other bits and pieces as well, so we'll make it really fun and interactive. But it's absolutely fabulous to welcome you this morning. So I'm going to hand across to my my fellow colleagues. Rob, are you happy to introduce yourself?
Sure. Hi, everyone. My name is Rob Cutforth. I'm the Senior Learning Technologist for the Florence Nightingale Foundation. So I do I manage a small team of technical people that we build the coursework and put them online. So if you have any issues with your logins or managing the course, we're the people to talk to. So that's me.
Brilliant. Thanks, Rob. Thank you so much. And Martin, are you happy to introduce yourself as well? So these are the creative brains behind the programme that build it all for us.
Hello, everybody. Yeah, Martin Agenbar is my name. I'm a learning technologist. I work with Rob. And as he says, we bring all the stuff together that constitutes the content of the course, and we make it so that you can see it online. So that's our job. We make sense of it and put it into a package that you can use and understand. So that's my job.
Thanks, Martin. Thanks so much. And Ryan, are you happy to introduce yourself?
Hi, I'm Rye. I've recently joined over into Rob and Martin's team, and I do a lot of behind the scenes stuff, trying to get everyone coordinated and sorted out for the course. So probably the one to answer if you have any queries or technical issues on the course.
Brilliant. Thanks, Rye. So this is the team behind the programme. If you want any support over the next few weeks for your programme, these are the guys to contact. We'll be here to help you with any queries you may have. I'm going to also ask Dave to introduce himself. Dave Cunningham, who's the commissioner of the programme, and some of his colleagues as well. We've got Sonia and Amber with us as well. So I'm going to go to Dave first, if that's okay.
Thanks, Lucy. Morning, everyone, and welcome. My name is Dave Cunningham, so I'm one of the clinical leads within the NHS England National IPC team, and my area of focus is around workforce and leadership, and my background is 20 years in ambulance service, so paramedic as a clinician and still work operationally. So it's been a pleasure to work with Lucy and the team to bring this to fruition and go through this again. So welcome.
Thanks, Dave. Thanks so much. And we've got Amber here. Amber joined us from Dave's team.
Hello, good morning. My name's Amber Coburn and I'm a senior project manager within the National Infection Prevention and Control team. So, morning.
Thanks, Mary, so much for joining us, Amber. And we've got Sonia, who I think is having some sound quality issues, but Sonia is the administrator program coordinator within the NHS team, within Dave's team. She helps coordinate. She'll be a point of contact as well. So a big team behind supporting you all through this fantastic programme. And we've had excellent feedback from the first cohort. So we're feeling pretty sure you're going to really get a lot from the programme over the next few weeks as well. So I'm just going to go through and share my screen with you all. You can see what we've got in store for you for the next hour. Great stuff. So welcome so much to the programme. What we've got ahead for you is a welcome from myself and Dave. So I'm going to give a bit of context and background to the programme, why we set it up and what we hope you get from it. We've got a welcome video from Duncan Burton, who's the Deputy Chief Nurse for England, who commissioned the programme and obviously works with Dave and the team as well. And also from my line manager, Professor Gemma Stacey, who was there at the concept of the programme. They're really wanting to raise that voice of healthcare support workers and really champion the IPC agenda. And we'll talk more about that in a bit. I'll give you a quick overview of the programme and deadlines, the live event, so to speak. So live like this, when we're actually interacting with one another. And I'll go through the modules as well that you'll do in your own time and go through at your own pace. Then we're going to go into breakout groups, just for you to get to know each other in smaller groups and talk about the hopes and goals. What do you hope to get from the programme and how you're going to support one another? Because there's lots of ways you can interact with one another. And the idea is that we really want you to support each other in a larger network and really start championing that IPC agenda. And then finally, we're going to close and we'll have time for any questions or queries you may have as well. So that's the agenda for today. So I'm going to just escape again and just wanted to talk to you a wee bit about the programme. And I'll stop the share, that's okay. So really the background behind the programme, I'd like to see also, if you can turn your cameras on, that would be really wonderful, because I do love seeing all your faces. When we won't bite, I promise. But essentially the idea behind the programme was set up obviously on the back of the pandemic. You know, I was telling the guys earlier on, I was a director of IPC back in a previous role, and no one ever wanted to engage with me in IPC, something I've always really cared passionately about. And when the pandemic came on, suddenly we were everyone's best friend, where everyone wanted to talk about infection prevention control and really raise that flag and really make sure that we're doing things properly, because IPC is essential to every area of nursing and healthcare. Now, whether you work in a nursing home, in a care home, in a dental surgery, in an acute hospital, it's really essential we get this right, the basics right. And to have champions that champion that cause is absolutely essential. So all of you being an army out there, challenging those doctors, challenging those healthcare professionals that aren't perhaps in line with standards and practices, and really empowering you, giving that and ensuring that you're leaders in your own right. And that's what we hope to do from this programme, is really raise your voice and give you the confidence of that impact and influence that you need to do at all levels across all areas of healthcare. And what's really great about this programme is that it's been commissioned not just for the NHS, but across all sectors. So that's for people, we should have people on this call from the care home industry, so people from dental clinics, I think in our last, community hospitals, acute settings, so that we're all raising that voice, as well as paramedics. Apologies on the paramedic teams as well. So really making sure that everybody's championing that voice. And what's really nice to see in the chat function is we've got people in Bournemouth from palliative care, Kelly, Jan from a care home in Swindon, we've got mental health trusts from Birmingham, but all over the country, we've got people really championing that cause. And we need you to keep flying that flag and raising our standards, because without us challenging and supporting and gently nudging one another, we can make sure we maintain those standards that are so important for patient care, for our patients, because that's what we want, the best outcomes for all of our patients. That's certainly why I went into healthcare anyway. I'm going to hand across to Dave now. I've spoken enough, just for Dave to give a bit of framing around the programme, and then I'll go through and we'll play the video from Duncan and Gemma as well. Over to you, Dave.
Thanks, Lucy. And it's great to see in the chat the amount of different sectors of healthcare that we've got in this group today, and looking through the list, that was one of the things that we wanted to really achieve, is bringing all the sectors together and representatives or participants from each of the sectors to help build them networks, but also to help support each of them sectors as they go. When the programme came around through COVID, and a lot of it was around some of the learning that we picked up through COVID and some of the challenges and how we support you guys and girls out on the ground and getting that message across, because it's all fair and well having guidance and policy and everything developed at the central level and then filtered out to you, but it's how you enact that and implement that and convey that with your colleagues and peers often. And bringing in the IPC fundamentals, which is the first 2 weeks of the programme, is good, because it gives you that basic understanding and basic fundamentals of IPC, and then strengthening, working through the leadership skills and giving you that confidence to check and challenge and support colleagues to help them change the way that they work and make improvements for IPC as we go forward. So it's been great to watch this programme come to fruition. It's been great to see so many people go through the previous cohort, and the really positive feedback, which, working with F&F colleagues, we've managed to increase, because there was so much appetite and interest in the previous colleague. We've managed to increase this by, I think it's almost 50% higher intake on this course to get it out to more people, which is great. And it'll be good to see how this goes through, and at the end of it, how you find it, how you've found it has impacted your abilities and skills out there in the day jobs that you do, and how we can help improve the future of IPC and learn from the issues and challenges and build on the good stuff that's come out through the COVID pandemic.
Dave, thank you so much. Thank you. And to echo Dave's thoughts, this is just wonderful to see all your faces on screen. I don't know, I hope you don't mind, would you mind if I took a photo of you to pop on Twitter or onto social media? Is everyone okay? Some smiles, some nods. If not, you can turn your videos off if you don't want to be on it. But really great if you can have big smiles if you've got your cameras on, that'd be wonderful. Give us a wave, whatever you feel comfortable doing. the big smiles. Thank you. I've got 4 pages of you. I've not had this big an audience before. Oh, lots of thumbs up, liking the thumbs up, Jean. Thank you. And Nicola. Oh, great. And Madeline as well. Madeline had her thumbs up. Thank you so much. I don't think we have such a big audience. So thank you so much. We'll get started, continue with the agenda. So I'm just going to share my screen again. Please shout out if it doesn't share this time. So we'll get used to sharing my screen.
So my name's Gemma, for those of you that I've not had a chance to work with previously. I'm the Director of Academy at the Florence Nightingale Foundation. And as Lucy said, at the inception of this idea was really at a time that infection prevention control was never getting so much attention. The world had become much more aware of the significance and the importance of everybody's role within infection prevention and control. And at that same time, the national team were rolling out their best practice guidelines for health and social care. And it was an interesting conversation at the start, which was really about, if we are going to make these guidelines actually count in practice to really make a difference and not be something that is sat in a folder or on a web page somewhere and not actually accessed by those that are using it, which part of the workforce really need to know about these things. And there are those people where IPC is the main focus of their role and they are specialists in the area. And of course, they would be aware of it. But actually, the workforce that was going to need this and was going to be utilising these guidelines possibly hundreds of times a day would be you guys. You were going to be the people that would bring these best practice guidelines to life and really make them count in the real world. And what we recognised, and the reason why there's the champion aspect of this programme, is that you have significant opportunity to influence how others understand infection prevention control. As the experts, you're using this constantly in your day-to-day practice. But we recognise that in order to influence others, and that might be those that you perhaps perceive as senior to you, other healthcare disciplines who might perceive themselves as to be more senior, that actually you would need some skills and you would need some support to enable you to develop the appropriate ways really of having that kind of influence. And that might be about confidence. It might be about how we present our ideas to others. It might be around having the right kind of language that other professional groups will really start to listen to and take notice of. And really that's why we've designed this programme in the way that we have. So the idea is that even though you are doing this on a day-to-day basis and you are confident in your own IPC practice, how can we spread that and how can we help you to influence others and really make them aware of the standards that are needed? So I must say to you, this is not your average online learning programme. There's not loads of text. You don't answer multiple choice questions at the end of it to tick a box and just click through onto the next arrow to move through it as quickly as possible. The way that we've designed it is to be very much along the lines of how we deliver our Florence Nightingale Foundation leadership programmes. So it's fully experiential, it's full of different videos, examples, and encouragement for you to start to reflect on and practice the skills that we're sharing with you. And so the team have worked really hard to think about how we bring these concepts to life and how we can also encourage you to engage with each other, because what we know will be the key golden thread that will really enable this programme to have impact is if we help you guys to network together and to be a support for each other, and also for this programme to have a life beyond its start and finish, and you'll continue to be that support for each other moving into the future. As Lucy said at the beginning, once you're part of this F&F community, we never let you go. We use the phrase F&F forever, and it is absolutely true. Once people come through our programs, they're connected with a community of like-minded healthcare professionals who are all committed to doing what they can to make the best outcomes for the people that they support. And so you're part of that now. From the day that you stepped onto this programme, you became part of that. And we want to encourage you to take on all of the advantages that offers to you. So please do consider this as the start of a longer term journey with the foundation, with the national team, with each other, and enable us to help you to keep developing from today and forevermore.
I'm Sue Millward. I'm an infection control nurse, but I work within the National Infection Prevention and Control team under Dr. Lisa Ritchie and work with Dave. And my lead area is education. So I've been really excited to develop this education programme with my colleague, Liz Grogan. Thank you.
Thanks and good morning, everybody. My name's Duncan. I'm the Deputy Chief Nursing Officer for the NHS in England, and it's really lovely to be with you this morning. I look after a number of different things on behalf of the Chief Nurse, which includes the Infection Prevention and Control team at NHS England, also nursing workforce, and lead on things such as the Healthcare Support Worker Programme and the recruitment programme for the NHS, and also work with maternity services and look after the Children and Young People's Transformation Programme. So it's great, actually, that we've got a couple of my worlds colliding here together in terms of support for the work we do around healthcare support workers and development of healthcare support workers, which this is a fundamental part of, but also then how do we strengthen our approach to infection prevention and control across the NHS and beyond, because this is something that has been absolutely fundamentally critical over the last couple of years. Well, it's always been fundamentally critical, and actually, great to be working with the Florence Nightingale Foundation. And obviously we've just had a quote from Florence Nightingale, and obviously Florence Nightingale absolutely was a champion for infection prevention and control. And if you think around the work that was done because of Florence Nightingale, it's actually great to kind of combine all of these elements together. And so if you do reflect actually on the last couple of years and the pandemic and the fact that people have had to adapt and to flex approaches, very short notice, new guidance all the time, but really the fundamental working with patients and making sure that the safety and protection of those patients and our colleagues as well and yourselves has been absolutely fundamental. And there's no doubt, because of the work that you've done and colleagues have done, that lives have been saved in the prevention of infections spreading and therefore impacting patients. So as you go through today and you go through this program, actually just reflect on the difference that you've all made to both patients and colleagues, because you have. And when we discussed, I think it was last year really, actually we had a discussion around what more can we do to strengthen the work that we're doing on infection prevention and control. What more can we do to make sure actually that we don't just focus on providing support and training and education and leadership for our registered workforce, but also our healthcare support workers, because you are all leaders in this space, and that's why it's really important that this program focuses on your leadership roles as champions for infection prevention and control. So I just wanted to come along this morning and just say thank you for joining this program. We hope to see this grow from strength to strength. Let us know how it is. We always think it's important to learn as we develop these things. What can we do different? What can we improve on? So we need to respond to your needs as well as other things. So please do let us know if there's things we can do to improve the program. And look, I look forward to hearing how it goes. And thank you to the national team as well. Dave, Sue and Lisa for all the work that they've done in pulling all this program together, and I hope it really develops into something that others will wish to apply for in the future. So thank you.
Thank you, and thank you all for your comments around the sound. We'll send it out to you separately as well, so you can watch it if you're having problems with sound. You did have to maybe turn the volume up a bit, so thanks for your comments in there. There's some really wonderful kind of introductory messages from Professor Gemma Stacey, from Sue Millward, who was one of the collaborators on the programme that built the modules, and also from Duncan Burton, who is our Deputy Chief Nurse for the country. So really encouraging words. So please do take a lot from this, that you're on the programme. You're the second cohort. And it's really wonderful to see so many of you engaged and ready to get started. I think what's really key, I think the key thing I took from Duncan's words is reflection is absolutely key. Think about how far you've come over the last couple of years and actually what you want to get from the programme as well. Great stuff. Some nods across the team there as well. So it's nice to know that resonates with some of you there. You're great individuals, each and every one of you. You're champions in your own right. I'm just going to share my screen again. So check things, and we're going to go through the learning outcomes of the programme. And just to make you aware, you now all have access to the learning management system, LMS as we call it, as we all have an acronym, learning management system, to log on and start having a look at the modules that are available. And you've also been sent access to your MBTI, so that's your Myers-Briggs Transactional Indicator assessment as well, which I'll talk more about in a moment. But you should have those emails in your inbox. If you don't, please do let us know and we can re-forward them to you as well.
Lucy, can I just make one query? Or
yeah, of course. Just
to say that you will receive an email with the password in it. When you go to log in the course, it'll ask for your username, and your username is your email address, the email address that you've used to sign up. So that's one element that won't be in the email. So we'll send you another email to tell you that, but just so you know, that's your username.
Great stuff. Thanks, Rob, for that clarity. Lots of nods across the team. Great stuff. All people asking to resend it. Okay, we'll pick those queries up, right? That's if you're able to. Great stuff. So I'm just sharing my screen again. Just going to make sure, can we see the learning outcomes? Can everyone see that? Rob, I'm looking for you for a bit of a
yes, you can.
Lovely. Thank you very much. Just confirming. So just going to quickly go through. So the aim of the programme we've obviously covered off, but just really want to make sure you're aware is it's really about your leadership identity, how we can encourage you to raise your voice and look at the influence you'll have at organisational and patient outcomes. And as Dave has said, and Duncan and Gemma, you all will contribute to that bigger picture. And actually you will influence at local level, might well be system, national, but also look at the healthcare delivery. And the programme outcomes are really looking at enhancing. So this isn't your traditional online programme, as Gemma said, it's not a tick box exercise where you flick through as quickly as you can to get the questions at the end. This is about you really immersing yourself in the learning, looking at your personality preferences, and we'll talk more about the modules in a moment. So you're going to do an MBTI assessment, which some of you may already have done in part of your other roles, but actually we'll start looking at you as a leader. You know, how do you lead? What's your personality preferences? How can you be more effective? How can you perform better in teams? How can you communicate more effectively? Let's start looking at that real, what we say at the FNF, your superpower, which is self-awareness, looking inside how you can be better to lead and influence others. Next, we look at identifying and critically appraising the opportunities to influence, so building on that self-awareness and that emotional intelligence, looking at how you can challenge authority, you know, in a very professional way, obviously, and that's how you can step up to authority as well, and how you can make sure you're ensuring standards are met. Then we look at ways of how you can influence. So we've got a module with the amazing Royal Academy of Dramatic Arts. So that's RADA. Actually, RADA, you're all going to RADA, darling. Bit of a check there, where you'll be actually looking at your personal impact, how you communicate, how you can have influence over the way things are done. And it's life skills, honestly, so I've been through the programme with RADA before. It's life skills that will translate across all areas of your life as well, not just IPC. You'll develop and explore personal resilience, you know, to help you stay cool under pressure and how you can continue to be effective. And also we've got a module on quality improvement. So how can you really help to drive that quality improvement agenda as well, looking at improved patient outcomes and looking at the methodology as well that underpins that. So that's the outcomes that we hope for you for the programme. We've got some live dates for you, which you've all had in an email, but just in case I've got to go through with you again, we've got this recorded. There's obviously a launch today, so 88 of you on the call, so I think you obviously got the message about dialing in. We've got an optional check-in on the 20th of September. If you've got any queries, any questions about the modules, you can connect there and we can answer any queries you may have, and that's at 11:30. But obviously in the meantime, you can email us as well if you have any problems if you can't make that time. You also have your interactive, so live sessions as we call it, with the co-consulting sessions. So that's 3 hours. You'll be blocked into sessions, cohorts of 6, to really start exploring your leadership and looking at how you can support each other and build that resilience, as we spoke about earlier in the learning outcomes. And then finally, on the 31st of October, so a few weeks away, we have the wonderful online celebration event where we'll share your stories and your feedback, and we'll get together to collectively celebrate your achievements through the programme and reflect on your hopes and goals that we're going to discuss today, and really about making sure we continue and champion that agenda and making sure you network and support one another. Okay, so the online modules, which some of you might have already logged in and had a bit of a sneak. So the first program is really just making sure that we're standardizing that approach to infection prevention and control. And that was written by experts Liz Brogan, who sadly can't be with us today, and Sue Millwood, who we saw earlier on in the video, who actually have pulled together a really great model to make sure we're benchmarking. So some of you will be some revision, some of you there may be some new concepts, but it's really making sure you understand the basic principles of IPC. Then we go into the leadership element of the program, which is the MBTI assessment, which we've just spoken about, and the personality preference module. There's a short video from myself and Gemma on there. Then there's quality improvement module with Claire Henry and Associates, which Claire is an expert in QI with receiving an MBTI. So all of these associates are really high caliber individuals who are there to share their expertise and knowledge with you. Then we have RADA, as we spoke about, so that is Royal Academy of Dramatic Arts, and their program's actually amazing, and it does translate onto online as well. So really practice their signposts and practice their ideas. It really will help in the long term. I think one of the things I'll come back to is breathe, remembering to breathe. Then we have Pippa Goff, who's worked with the King's Fund and the Health Foundation, so we may know, a real expert in facilitation and learning. And she does lots of videos on using your authority. So building on that emotional intelligence we spoke about earlier, that self-awareness, and really starting to step up and challenge and raise your voice to ensure that we're maintaining those standards. Then finally, there's a co-consulting module. So those of you that may have done co-consulting previously, it's about how you talk through issues, how you can resolve, how you can improve your resilience and make sure that you are really ensuring you can be the best leader you can be for your teams, your colleagues, and for each other. And then we have the live action sets, which we spoke about. So that's done after those programs as well and through. So that's the modules for the program. I wanted to share a Florence quote because we have to have a Florence quote. And for those of you, so the Florence Nightingale Foundation was set up in 1929 following the death of Florence Nightingale. She left a legacy within her will that she wanted to continue the great work of her life. And this quote really resonates with me. So when I am no longer even a memory, just a name, I hope my voice may permeate the great work of my life. So each and every one of you are part of that legacy that Florence wants to leave. And obviously she was a huge champion for IPC. She was one of the first people to actually demonstrate statistics and share that. I'm not going to share too much about that because we've got a quiz for you in a moment. But she really was a pioneer. She was a blazer of trails. And you were part of that. As Gemma said in her talk earlier, you'll be part of the F&F family, part of Team Florence, where you can champion that great work and be part of that wider alumni network as well, be part of the supporters and part of our community. So we've got a bit of a quiz for you all. So I'm going to look for hands up, a bit of a clue for you there. So if you're able to give me a quick wave so I know you're all online. Oh, thank you, Alison. Thank you, Emma. A few of you are coming up on my screen. So if you feel confident you know the answer or want to have a guess, just want to check your Florence knowledge for a bit of fun. So does anyone know when her date of birth was? No trick question, have a guess.
I do.
Oh, go for it, put your hand up. I can't see everyone unfortunately because I'm sharing my screen. But if you let me know.
It's Fiona Welsh. She was born on the 12th of May.
Wonderful. And Fiona, for a bonus point, you know what's the significance of the 12th of May or anyone else?
It's my birthday.
Oh, there you go. Wonderful. And anyone know other than Fiona's birthday why it might be significant as well?
It's International Nurses Day.
That's correct. And Fiona's birthday, which is wonderful. Thank you, Fiona. That's made me smile. Great stuff. So International Nurses Day, absolutely right. And we at the Florence Nightingale Foundation have a ceremony at Westminster Abbey every year to celebrate the great work of nurses, midwives, nursing associates and healthcare support workers as well. And it's absolutely amazing. After COVID, we've got our first one this year. Over 2,500 nurses, midwives and healthcare professionals packed into Westminster Abbey to celebrate her great work on the 12th of May, Fiona's birthday, and also Florence Nightingale's birthday too. I won't forget that, Fiona. Great. Okay, well done. 1820. So where was she born? Does anybody know? No? Anyone fancy taking a guess? I'll give you a clue. The clue's in the name. What hazard a guess? Pop it in the chat if you feel able. I might get Rob to tell me because I can't see the chat from sharing my screen. Anyone know?
Yeah, we've got a couple of guesses.
Italy, Florence, Italy.
Florence, Italy. Well done. Who was that? So I can call out the right answer.
There's loads.
Well done. Well done.
Mark, Signa, Gina, Lynn, Julie, and Jean.
Excellent. That's correct. She was born in Florence in Italy. That's absolutely correct. Well done. And she's got a sister called Naples as well. Not quite the same ring, has it, as Florence, but there you go. So long before the Beckhams, they were naming their children after the place of birth. So there you go. Florence was a pioneer even before she was born. What was the institution she founded? So I think I saw in the chat a couple of people that may know this, because they may work for this or nearby this institution. So if if you're able to monitor the chat for me, if people don't feel brave enough to call out, let me know. Or if anyone knows, put your hand up, put your virtual hand up, and I can ask you. Anyone know? No? Anything in the chat box, right?
Oh, we've got Labour Foundation of Professional Nursing.
Oh, it worked.
On Sophie.
On the right vein. Any advances? I think I'll kind of be interested.
The first nursing school.
Phil, thank you. Thank you very much for knowing that. And I actually went there, but not when she opened it. I'm not that old. Not quite anyway. I'll feel it someday. Yeah, absolutely correct. She started the Florence Nightingale School of Nursing and Midwifery, based at St Thomas's, for those that maybe are based in London or been to London recently, right on the Thames. And it was phenomenal. What she did back then, the South Bank wasn't as an affluent area, is probably the best thing to say. And what she wanted to do was give people the opportunity to have an education, those that were from poorer socioeconomic backgrounds. So she set up the School of Nursing. The first cohort was surprisingly full of drunkards and prostitutes, apparently. So, but she wanted to give them a better life and give them empower them with knowledge and education. Just in case you're wondering, I don't fall into either of those groups, just so you know. But it's great that she gave the opportunity, and that really gives you an insight into her character. She really wanted to lift people up and give them that education. And some of it, if you ever get the opportunity to go along to London, they still have the same wards. So Lane Fox ward is one of the original wards in St Thomas's. I remember appearing as a student nurse to see those lovely long wards that you used to see back in the day. And I've got one of those badges as well somewhere as well. But well done, Phil. Great that you knew that. So she set up the first School of Nursing, and it's part of King's College London, if any of you are interested as well now. Encompassed, I think, back in 2000 and something, into the King's College London. Right, what did she invent to show her health data? Give you a bit of a clue earlier on this one. Oh, Fiona, go for it.
Wasn't she the first one to do like an audit of how wound management was done and what worked and what didn't?
Close, because it was around wound management. Absolutely right. I'll let
in
you
the chart we have from Jean, we have a pie chart in the chat.
Well, yes, well done. So Fiona and Jean, well done. It was the coxcomb, which is affectionately known, which you'll know when you see it. So similar very much to a pie chart. She was the first person to demonstrate practice in this way, the evidence-based practice, and how apt for all of us today. It was about illustrating the fact that more soldiers were dying from preventable contagious diseases, first realm into IPC, rather than from their battle wounds, and really demonstrated this through her data. And this is what you guys do day in, day out. So really interesting for you all to know. There's a bit of a fun fact about Florence there. And finally, if you get the opportunity, there is the Florence Nightingale Museum, which is based at St Thomas's, where you can learn lots of fascinating facts like this. I got far too excited when I attended. And the actual lamp is in there as well, the lamp, if you wanted to go along and see it. What was really interesting, she was the first female to be accepted into the Royal College of Statisticians as well. So she was blazing a trail long before we could even vote. So there you go. She was an absolutely formidable and incredible woman. And you're following in her footsteps in her legacy, being part of the programme and part of Team F&F. Great stuff. So we're going to go into breakout groups now. Rai's going to put you all into breakout groups. I'm just going to unshare my screen so I like to see people's faces. For you to get to know each other a little better, you're going to be in small groups. And what we'd like you to talk about amongst yourselves is, what do you hope to get from the programme? We've given you an overview, of the programme and what to expect from the programme, virtual and online, and live events. What do you personally want to get from your leadership journey? Because we want to come back and recap on those at the end of the programme. And also, how are you going to support one another within your groups as well? So we want you to start thinking about how you can support each other, that wider alumni that we spoke about, that community, is that we don't want this to finish, your learning and support to finish at the end of the programme on the 31st of October. We want this to be the start of an incredible journey for you. And I'm part of the alumni. I was so grateful for what the Florence Nightingale Foundation did for me. I came to work for them, and I can absolutely say this is the start of an incredible journey for each and every one of you. So we're going to set you off into your groups. Just checking the time, if we give you 15 minutes just to go back and just get to know each other. And if you can set up WhatsApp groups, that would be great as well. And then we'll come back and we'll have 5 minutes for questions and a quick check-in, and give you a moment to kind of catch up. So thank you all. I'm just going to let Ryan work his magic. And
yes, everyone is back with us.
Great. Well, welcome back. I hope you found the groups helpful. So obviously it's not long, is it, 15 minutes to talk about your hopes and goals, but start thinking in that vein and start reflecting. Use that towards your reflections through your programme. There's plenty of time to reflect through the programme. There's elements throughout to do so. What I also want to share is there's something called a Padlet on our programmes as well, which will pose some questions for you to interact with each other there. So it's more live, and that's live so you can share your comments, like each other's comments as well on queries and questions around the programme. And Rob takes great delight in sharing all of those with us all as well. Great stuff. So we've only got 5 minutes left of the programme. If you haven't been able to set up your WhatsApp groups, please do let us know, and we can help and support you with that, or if you didn't want to be part of that. And then we've got 5 minutes for questions, and that's Lydiona. That's very good timing. We've got time for questions. So any questions? How can I help?
Hello. So my
Hi.
question is regarding the WhatsApp group. So we tried to manage and send our WhatsApp numbers through the chat earlier, but I don't know if we all that we were in the team managed to send through. So we might need some time more, maybe, please.
Yeah, sure, we can put you in breakout groups. Yeah, and Ryan, you happy to manage that? Is that okay?
Yeah,
Thank
yeah.
you.
Yeah, we can do that again. No problem at all. No problem.
Thank you.
Thanks for flagging. Thanks for flagging. I think maybe that's some feedback for us as well. Maybe we'll give you a bit more time to take the feedback groups. Thank you. Thanks. Great. Any other questions about the programmes?
Yeah, should I just send my number through the chats? Yeah, my phone number through the chat?
Yeah, that's fine. Don't worry. If you hang on, Sarah, we can catch up at the end. I think we've got some messages in the chat as well. And just
Phil's just said his fire alarm.
Phil, no problem. You have to leave. There's a fire alarm. Phil, keep safe. We don't want anything to happen to you. That's great. So just to reiterate, I think we've had a bit of feedback just from some overview, is that you should have all received your assessment for the MBTI, and you should have also received your links to log into the learning management system. If you haven't, what we have found is that sometimes you're going to end up in your spam because of really sensitive firewalls. So check your spam and check your junk. The fact that you've dialed in today is good. That means you've got our emails and got the links to the programme. So please do double check. If you have any queries at all, email our dedicated mailbox. Rise on hand to answer any queries that you've got to support you through the programme. So please do let us know. We want you to have a really great experience. Please do give your feedback. There's an evaluation at the end of the programme that we'll share with you on the 31st. We really love you to complete, because we compile all that information and share it with Dave and the team. And we really want to improve and make it as interactive and as supportive as we can do. At the end of the programme, as I said, you'll be part of Team FNF. So this isn't the end of your Florence journey. You'll be part of the supporters, and you'll have access to our newsletter and any opportunities that come up through that. So please do keep your eyes out. There's lots of other programmes that we run, and hopefully this is just the beginning of the Team Florence journey. That's been great. Is there anything else, Rob? I'm going to lean to my team if I've missed anything out. So just keep reflecting through the programme. Rob, anything that you wanted to share with the group before we sign off?
I would just say that I'll be sending an email out with a link to the video that of Gemma and Duncan to everybody, and I'll just send you another link to the course itself and let you know how to log in again. Just a reminder.
Yeah, so those of you who had problems with your sound and didn't hear the video as well, we're going to send you a copy of that if you want to watch it again. There's some really lovely messages in there. I'd hate for you to miss that, particularly from Gemma and Duncan. So please do keep an eye out. Great. Okay. Right. Anything you wanted to add from an administrator?
So just another question saying, is it possible to have this session sent out to everyone to replay?
Absolutely. So we've recorded it all, and we'll send it out to you. Just have a quick edit, and then we'll send it out to you all so you can read back through, and you've got the slides as well with all the information on as well. That sound okay? Great,
Yeah.
good. We'll send it out to all of you as a cohort.
And so people are just putting their numbers if they feel comfortable in the chat to be added into WhatsApp groups. So if you feel comfortable.
Great. And I'll share, if you don't mind as well, I'm going to share a picture on Twitter. Feel free to tag yourself in it. I don't know if I remember to tag all of you, so I'll try my best. But please do if you're on Twitter. And we've got a great Twitter following on Florence Nightingale Foundation. It's a really great way to stay connected with the wider community on topical issues as well. So please do join us on social media. We've got a really great community that are all there waiting to support you as well. Great. 10 session of co-consulting, just one session of co-consulting, Julie. Good question. One session of the co-consulting with so it's 10 in total with 6 in each group. So one session of co-consulting, not 10.
And the dates will be coming fairly shortly.
Yeah, Ryan will be showing those. The Twitter account is Florence Nightingale Foundation. I believe it's
I'll pop it in the chat for you guys.
Thank you, Ryan. That would be great.
You're welcome.
You type in Florence Nightingale, it'll come up. I'm thinking what exactly our handle is. Oh, thank you very much. F Nightingale. Thinking. Thank you, Ryan. We are on Facebook, but that's a really good question, Juliet, because we do need to become more active on Facebook, but we are on Facebook as well, Florence Nightingale Foundation. On there, you'll find us there. We're on LinkedIn as well, if you follow LinkedIn. And I'm sorry I'm a bit of a dinosaur sometimes, TikTok as well. Is that right, Ryan? I got that right. Yes, good, okay. You don't need to do Twitter, by the way. It's not a prerequisite of the program. It's just if you're interested in staying in contact. Okay. Good stuff.
Grab the LinkedIn one as well.
Well, we've just gone over time. Thank you so much for joining us. We really hope you enjoy the program. You've got some excellent, best facilitators in the country kind of supporting with the program. So please do immerse yourself in it, enjoy it. Please do send us your evaluations, any questions or queries you have. We're here to support you through the next few weeks, and really we look forward to seeing you on the 31st of October to celebrate your successes through the program. Nice smiles from you all. Take care. Have a really great Monday, and see you all soon. Take care, Juliet, Sophie, Helen, Amanda,
Thank
Prince,
you.
Phil, Sarah. Thanks for joining.
Thanks, everyone.